Double eyelid surgery done 4 months ago. Is this normal? Hi, it's been 4 months since I got double eyelid surgery. However, I do not think it is obvious at all, and it made no difference to my look. My surgeon says it takes about a year to look like real double eyelids, but I do not think he did a good job. Is this normal? I don't think my eyes look any bigger, and most people I know do not see a difference. Thank you.
Thank you for your question. You submitted 2 photos and you stated in your question that it has been 4 months since your eyelid surgery and that you don't see much of a difference, that you are concerned that the results are not as you desired. Your surgeon states that it takes about a year to see the final outcome, and you go on to also comment that your friends don't notice a difference either. Well, certainly I can give you some guidance as to how I approach Asian eyelid surgery, and what may be of benefit to you is how I determine if and when to do additional revision surgery. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. Asian eyelid surgery has been a significant focus in my practice, and I've been in practice over 20 years in Manhattan and Long Island. So I think that when you have to kind of look back at your initial consultation and subsequent discussions you had with your surgeon. And I'll go through the sequence that we go through. First, we want to determine if someone doesn't have a well-developed crease or a partially developed crease or just nothing at all, then we try to figure out what would look the most natural. And sometimes it just means taking a little instrument and pushing the skin in and seeing how the eyelid, what kind of shape forms. There are certainly branching points in the decision-making process. So we first start with the question is there excess skin? If there is not excess skin, then I generally use a non-incisional approach. Non-incisional basically means making little openings in the skin to pass stitches between the skin and the levator muscle, the muscle that lifts the eyelid, to create an anchor point for the skin to fold when the eyes are open. If there is excess skin, then I take away skin. Then there's a decision point that is typically, for me, consistently one that I prefer, which is a nasal taper, and that means going towards the epicanthal fold, or a parallel crease, which is parallel to the epicanthal fold. I feel like my goal is to try to create a natural look, as if nature had created a crease, and usually that means more of a nasally tapered fold. Now, the question of how to determine the success of the procedure. When we see our patients, we see them actually during the surgery. I will actually have my patients open their eyes to make sure that the crease is anchored well and it looks as I would anticipate. In addition, and sometimes I'll even sit somebody up and look at them to make sure that things look good. Now, if initially you will notice that the eyelid, and what unfortunately is a partial limitation of Asian eyelid surgery, is that the initial appearance can look exaggerated. In other words, the swelling between the crease and the eyelashes can be elevated, that can result in a look that looks like an artificially high crease. So yes, there is a certain amount of time that we have to allow for natural swelling to diminish. Now, as far as your difference in perception with your surgeon, the question really is there swelling? Is there scar tissue that's not necessarily healed to the level that it needs to be? The reason why that I can't give you a definitive answer is that in the absence of a physical examination, it's very difficult to just say yes, answer a question yes or no. Now, I am sure you chose your surgeon having done your research and homework and then choosing someone that you felt had more than enough experience performing Asian eyelid surgery. And I would state that amongst colleagues, that people who do have experience with Asian eyelid surgery are generally fairly knowledgeable and are experienced enough so that they can anticipate what would happen in any given scenario. So the question you have to ask yourself is, what is your ideal outcome? What is missing right now? Do you want the crease to be deeper? Do you want to see the skin fold over more? Is it just that you ended up having a surgery where a subtle crease was created, but you didn't have that much skin, so you didn't have that much of a fold? I think the majority of concerns that people have when they come to see me for a second opinion, as a cosmetic oculofacial surgeon in the Upper East Side, I certainly get my share of second opinions. I would say that it's often a miscommunication between the doctor and the patient from the word go. So I think you have to sit down with your surgeon, and there is no reason to rush unless there is a significant issue, which there doesn't seem to be. And if your surgeon is comfortable with waiting a year, certainly that's not unreasonable. My feeling is that once the swelling has diminished, I think it is reasonable to consider doing a revision. So that could be as early as 6 months, but there's a range. So meet with your doctor again. Try to get some definitive ideas that, like, ask what would happen after 1 year. What exactly would the doctor do to revise the result? And is there a high likelihood of success? I think this dialogue is very, very important. You can certainly get additional opinions by having other doctors examine you, and that might be what's necessary for you to feel assurance about this path in terms of waiting. So once again, meet with your doctor, get additional opinions, and see what kind of outcome is feasible given that you've already had a surgery. So I hope that was helpful. I wish you the best of luck. Thank you for your question.